Hi everybody, Dr. Michael Horowitz here with Vancouver Orthotics. Today's video blog discussion is on ankle pain and ankle sprains. Now, have you ever sprained an ankle? What ends up happening? Well, most ankle sprains are called inversion ankle sprains, where your foot and ankle roll in. And what happens is you've ultimately torn some of the ligaments or the tendons around the ankle, and there's a lot of inflammation and swelling and pain. Now, 3 weeks later, you'd like to think that this condition is healing and improving, and often it takes longer than you might expect for that ankle sprain to heal, especially if it's your first one, and it could be a lot of pain. So, of course, the types of recommendations we make for patients are rest and modified activity, and we might recommend the RICE phenomenon of compression, rest, ice, compress, and elevate. And all of these are very important ways to help that foot and that ankle heal. But what happens when you have chronic ankle sprains, where the ankle sprains or rolls again 3 months or 6 months or 1 year later? If you're someone who experiences ankle pain and you've had a history of ankle sprains, you might be looking for more stability, more balance, and better shock absorption. And one method to achieve that is with the use of a custom orthotic insert. So here's an example of a custom orthotic insert. It's a sports orthotic, perfect for running shoes or hikers. We also make orthotics for flats and for casual shoes and for heels. And the purpose of an orthotic is to help maximize your shock absorbing capability, so that instead of absorbing each step that you take, you're able to disperse. And by doing so, there's less stress and tension that build up into your foot and into your ankle. By creating better alignment of the feet and better stability, there's less of a chance that your ankle is going to roll. In fact, if you have chronic ankle sprains, we're going to probably recommend an external posting to the orthotic, which will help add additional stability. So if you're here looking for information on how to improve your ankle pain or to reduce further issues of ankle sprains, you've come to the right place. My name is Dr. Michael Horowitz, owner of Vancouver Orthotics. I'll be working with you. And what we do is we use 3D technology, a 3D foot scanner, an electronic gait scan, as well as a variety of other orthopedic tests to ultimately diagnose the symptom or the condition. And once we have a diagnosis, we can come up with a game plan. Our game plan may consist of a custom orthotic insert. For more information, visit our website at vancouverorthotics.ca. You can always book an appointment online, or you can always email us with any questions you have, because that's why we're here. We're here to help.